Ladies and gentlemen, dear friends and colleagues, this is an honor to participate to the Pharma Logistics Africa virtual event and to share today this panel number 5 on health emergencies, epidemics management strategies and preparedness. Considering the huge impact on the health supply chain in Africa of the unprecedented pandemic, this topic is crucial. Preparedness measures and strategies should be in place to support member states in their efforts to respond to disease outbreaks, and our panelists today will enrich the discussion with their extensive experience in this area of work. First, let me start by introducing myself. I am Virginie Boll, the coordinator of the IMPACT initiative. IMPACT stands for Importation and Customs Clearance Together. Nothing can be done in countries if medicines and medical equipment cannot be imported or are imported with delays because of bureaucratic and administrative impediments. Minimizing, if not eliminating, unnecessary bureaucratic obstacles is key to enhancing humanitarian organizations' ability to reach people in need in a timely manner. Therefore, the mission of IMPACT aims for countries and humanitarian organizations to be comprehensively prepared to effectively manage custom clearance and importation processes for disaster and crisis relief goods and equipment. When goods have arrived and are cleared at the customs, how the pharmaceutical sector can solve pressing problems in the continent on the humanitarian level to ensure the delivery and distribution of correct medical equipment and medicines during a disaster or disease outbreak. This is what we are going to discuss with our panelists today. I will then first ask them to introduce themselves. So please, Mr. Kai Dede Submu, can you please introduce yourself? Over to you.
Thank you very much, Virginie. Thank you very much, everyone listening, and pleasure to meet the panelists. My name is Dr. Kai Dede Submu. I currently work with UNICEF as a senior manager in Copenhagen. Largely, I oversee and provide advisory services to countries within the Gavi portfolio, about 50 plus countries. And over the course of the COVID pandemic outbreak, we've been supporting countries to strengthen the existing systems and ensure that they have robust resilient systems to be able to deliver COVID-19 vaccines, working with alliance partners, Gavi, UNICEF, WHO, CHI, GSI, Village Reach, and co. Pleasure to be here, and look forward to the discussions. Over.
Thank you very much, sir. Let me now ask Mr. Ibrahima Jabi to introduce himself. Over to you.
Yeah, thank you so much. My name is Ibrahima S. Jabi. I am a public health officer by profession, and I went through Gambia College and do my public health studies. Then work with Ministry of Health and Social Welfare by then, but now it's only Ministry of Health. As a public health officer in the provincial regions, then I came down to the urban settings, where I work in different health facilities. So from there, then I moved to Gambia Red Cross Society to work as a health officer since 2016, and up to date, I'm working with them. But during the course, Gambia, you can have chance to be going for work at the same time, going for studies. So during the course, and I started Gambia University also doing environmental science. So environmental sciences, I'm on my final year. I completed all the courses, and now I'm doing my thesis. So which in fact is completed. I just submitted, but it's not yet. The results are not yet out. So that is the final stage of my studies at the University of Gambia. So with Red Cross, I have series of activities that I do, ranging from mental health issues, psychosocial support, and other health interventions in terms of prevention, disease control, and so on. So those are the works that I normally do with Gambia Red Cross Society as a health officer. Thank you.
Thank you very much. Dr. Emanuel Lagogo, can you please now introduce yourself? Over to you.
Good afternoon, panelists, and everyone who's listening to the webinar. It's a privilege to join you. My name is Dr. Emanuel Lagogo. I'm based in Nigeria. I work for Resolve to Save Lives in Nigeria. I've been involved in preparedness and response for global health security for a few years. Previously at the Nigeria Center for Disease Control, and I've been involved in conducting JEs in several countries across Africa. And I've been also part of the COVID-19 response in Nigeria. Supported a lot of the medical countermeasures initiatives and supply chain initiatives funded by various partners across laboratory and other consumables and requirements for the country. So it's good to be here today.
Thank you very much, sir. Thank you very much for the introduction. I'll give now the floor to Mr. Hitesh Chand. Please, over to you.
Thank you, Virginie, and thank you to all my panelists and all to those who are listening. My name is Hitesh Chen. I am a senior advisor at the World Food Program, where I provide support to the World Food Program in regard to their global health supply chain initiatives, pandemic supply chain preparedness initiatives, and more recently, the World Food Program's role in responding to the COVID-19 pandemic. I come into the space with years of experience in working in global health supply chain, medicines quality, understanding the global architecture of bilateral and multilateral dynamics when it comes to the delivery of healthcare services. And today I'm very happy to speak to you about the work that we're doing in the African continent, the partnerships we have established with the Africa CDC, the Africa Union in their response to supporting the COVID-19 pandemic. Thank you very much.
Thank you very much to you, and welcome to this panel as well. Let me now turn to Mrs. Naomi Ngari-Yua. Please introduce yourself. Over to you.
I am Naomi Ngari, working for Kenyan Red Cross in the Department of Community Epidemic and Pandemic Preparedness. We are covering several counties in the country, but our main key focus is behavior change for effective preparedness during emergency health and more so during epidemics. Thank you.
Thank you very much. Thank you very much to all the panelists. It is very impressive to have you all today in this panel. So now let's turn to the discussion that we are going to have today. And I would like to start with preparedness. And I have a question to Dr. Kai Dede Submu from UNICEF. Reports have shown that countries are not prepared to adequately respond to pandemics. What do countries need to do to be better prepared for subsequent health emergencies and outbreaks?
Thank you very much, Virginie, for that very important question. These reports, that, as you mentioned, that are openly available and well resourced, and they stem from existing reports generated by the WHO, looking at the gender XNI reviews, which I also supported a couple of countries to develop, but also a lot more recent indices for assessing health security capacities. The consensus on those measures is basically, as you rightly mentioned, that countries are not adequately prepared. We have seen this with the COVID-19 pandemic, and depending on how you slice the data, whether you decide to group by level of income, the consensus is that countries are not adequately prepared. However, it doesn't mean that nothing can be done. Speaking within the theme of this subtopic, which is looking at prevention, the best time to act is when there is no war. Basically you make preparedness and you prepare in times of calm. Unfortunately, it seems a lot of countries seems to forget in times of calm, and everybody runs into a frenzy when an emergency comes in. So in times of calm, there's quite a number of things that I believe countries can do. A couple of countries currently have existing supply chain systems that need to be continuously strengthened. I'll give an example. The current supply chain being used to deliver COVID vaccines, for example, is leveraging a lot of work that has been done in routine immunization over the last couple of years, 2 to 3 decades. Those may be responding to different target populations, but a lot of the resources and tools and coaching equipment, for example, are still leveraging those resources. So in times of calm, when things seem to not be happening, such systems need to continually be strengthened, in terms of the human resources, in terms of the tools. In terms of tools, for example, coaching equipment, because of COVID-19 vaccines and the type of vaccines that are being rolled out across countries, we've been pushed significantly to think of newer technologies that these vaccines require. So talking about ultra coaching equipment. While this has been sudden, I think the whole country or the whole world has been able to absorb this jolt regardless. So understanding the peculiarities of this is also essential in times of calm. But also very critical is that countries need to strategically invest in stockpiling. There's a lot of knowledge about what risk countries are prone to. So in times of calm and in terms of setting processes in place for prevention, stockpiling essential commodities ensures that when it's time to respond, there's adequate resources currently available that can be quickly mobilized closer to the source, so closer to the source, so for countries to be able to respond. I will also quickly touch upon some essential bits that the African CDC has been pushing on a lot, and I think within existing programs, push for local production. What this does is ensure that there's a lot more resources available to countries where they need, as regards alternative measures of sourcing these commodities. We belittle funding in so many ways, but we can categorize the issues on funding. You can appropriate the funds, but how it's released and utilized is also a different conversation. And this needs to happen when there's an emergency, but also in routine circumstances. But as I said earlier, during times of calm, you need to also build on those routine funding mechanisms or fund releasing mechanisms to make sure that you consistently and continuously build on your systems to be able to absorb any unforeseen events such as we are facing. And I think a lot of this needs to happen within a collaborative framework. There's a lot of partner resources, there's a lot of technical resources out there. Countries need to be intentional about prioritizing these resources to make sure that these add to the bottom line at every point in time, not cause fragmentation in the system, but build collectively to have a very robust and resilient system to respond to outbreaks, with also focus on their communities, because outbreaks can happen in a city, but most often happens in remote places and can easily get transported to cities. So within the most remote places, there needs to be focus on those areas, and countries need to be intentional at national and subnational level to invest in those systems. Over.
Thank you very much. It is a very, very interesting point. And on preparedness again, IFRC and national societies do play also a key role. As we have a representative of the Kenyan Red Cross Society, can you highlight the role that you have during health emergency and epidemic preparedness?
Thank you. Thank you very much once again. I would like to highlight the key roles played by Kenyan Red Cross during health emergency and epidemic preparedness. Kenyan Red Cross, being a humanitarian organization, has been playing a very key role in ensuring this coordinated response, and the community is well prepared to respond or even to be resilient during epidemics. So we have been holding continuous preventive community education, and this education does not only occur during an emergency, we do it before, during, and after health emergency. The approach majorly focuses on behavior change, as most diseases are preventable through adoption of health practices. Look for sharing a case scenario of the current COVID-19 pandemic. The mere behavior of washing hands has brought great change in disease spread. So this is what we are saying as an organization. Can we influence the community behavior? This will bring us very far in controlling and preventing spread of diseases. We know emergency health focuses not only on prevention. Emergency health also is centered in treating ill health and diseases. It also focuses on helping people to change the socioeconomic factors that affect their health. As an organization, we have looked into this, and we've also looked around and worked with other private sectors like pharmaceutical companies to ensure that this business continuity plans in place, and this helps in reducing epidemics impact and enhances resilience. For example, there's need for other stakeholders to ensure that commodities flow is well coordinated and that all the multi-sectors or stakeholders are well engaged. Private sector are encouraged to pre-stock medicine, for example. Logisticians are encouraged to ensure that the flow is well coordinated and all the key stakeholders are put into the picture. As an organization, we've been able to support by increasing the professional capacity of response structure through sensitization of response teams. When I talk of response teams, here I'm has a big body of volunteers, so we ensure that our data is updated. We have a database of surge teams within the volunteer, and we use holistic approach during emergency health, ensuring that all these our resources are well coordinated and in place in the right time. We are expanding, or we always expand our data of surge teams and deployment. We ensure that the database is up to date, so it's easier to operationalize it when an emergency or a crisis erupts. And when we are doing this, we also update the vulnerabilities. That is by mapping of hotspots. We have a calendar we call the community calendar. And this is very important because it will inform in decision making, in planning, and in programming. We cannot just think one morning that we have a disease where we don't know even what else we expect to happen. But when you have a pre-informed disease of disease areas, it is easier for us to plan because we know if this is the calendar of the year when we normally have, for example, eruption of cholera, we expect it to start in point A, B, and C. So we need this data in place. We conduct regular review of contingency plans. When we talk of contingency plans, these are plans which are also in black and white, showing us, stipulating clearly which are the response plans, which phases are there, what resources do we have, which are risky areas, what should we do during preparation, response, recovery, and rehabilitation. At the time we are looking into this, we don't do it for we need a multi-sectoral approach. So we ensure that other partners and key stakeholders are part of a plan in place also as of each organization is well identified strategically so that we don't have to struggle. Everybody will be ready to pop in and support with what they are supposed to do. We have pharmaceutical companies who are very important that every time we have discussions, we are involving them and the logistics, because occasionally when the diseases occur in the rural areas where you don't have access, we need to have clear plans put in place on how the resources, on how the drugs, on how the health human capacity will flow into the focal plans or places where we need support. So in summary, that's the role of Kenyan Red Cross during health emergency, which I can still summarize. We say we enhance community behavior change. We also enhance by increasing the professional capacity during response. We have ensured that we have database of surge teams in place. We are supporting in mapping of hotspot areas, And we also review contingency plans to include all emergency response phases and stakeholders. That is what we are doing. Thank you so much.
Thank you very much. And thank you very much for the contribution. It was really very, very interesting. What about WFP now? They are having and they have put in place preparedness measures and investment during the response to the COVID-19. Can you please explain what are these preparedness measures, please?
Thanks.
Thank you.
Thanks, Virginie. Yes, let me first describe what WFP's role was at the onset of the global COVID-19 pandemic. So when the pandemic began to spread around the world, at the time, the World Health Organization declared it a global issue, a global pandemic, we saw lots of border closures, restrictions on travel, cargo movement, and these were done and imposed by countries and country government authorities in an attempt to further decrease the spread of the COVID-19 virus. And so what that resulted in was limited commercial air transport capacity. So I'm not sure if many of you remember, but the entire world came to a standstill last year. And this also affected the ability of the humanitarian community health partners to react to any sort of like global direct public health threat, the COVID-19 threat, and any sort of humanitarian work that we would normally typically respond to, we could not be able to respond to. So the World Food Program, together with the World Health Organization, its UN counterparts, UN sister agencies, NGOs, quickly stepped in, and what was developed was the WFP COVID-19 Global Common Services. And so this Common Services was developed on the backbone of the World Food Program's logistics excellence, logistics capabilities. And what was achieved to that was actually quite phenomenal. I mean, at the time, it was even said that the World Food Program was the single largest airline in the world, because there was such limited air freight capacity, and global air transport was at its lowest. But what was achieved was actually quite interesting. The World Food Program delivered assistance to countries and passengers in over 162 countries. And that's about 82% of the world. And this also equated to the World Food Program distributing COVID-19 relief items to, again, 162 countries in the world. And that equated to, in logistics terms, 131,000 cubic meters of essential COVID-19 items. And at the time when it was impossible to transport air passengers, the Common Services was able to transport up to 30,000 passengers to 68 destinations, and on behalf of 436 organizations. And together with the UN Department of Operational Support, was able to medevac of over 206 individuals. So as the Common Services wound down in March of 2021, and that's because the global air freight market was tending towards normalization, the World Food Program then also invested at risk in firming out its temperature-sensitive logistics network, i.e. building out its cold chain capacity. Because we saw that, the world was now, upon vaccinating itself, never in the history of mankind has something like this ever been undertaken. And not one single agency, not one single partner, not one single government would be able to do this for the entire world. So as part of our contribution towards the COVID-19 response moving into 2021, 2022 and onwards, we invested at risk in building out a pharmaceutical qualified temperature sensitive logistics network. And we can speak about this in a few minutes, but what this actually means is that we activated our World Food Program country offices, have partnered up with groups like the Africa Center for Disease Control, and are now providing support to all partners in the COVID-19 response, particularly now looking at how to support distribution of COVID-19 vaccines to the final mile. So that's where we've come from, that's where we are going to. And I think it's going to be a very strong level of effort needed from all partners over the next few years to come. Thank you, Virginie.
Thank you very much, Hitesh. Thank you for the contribution. Indeed, WFP has been providing services to many countries and humanitarian actors to be able to deliver the goods. When there is such an emergency and when we try to prepare member states and humanitarian community, there is a need for training. And may I ask Ibrahima Jabi, how can sub-Saharan Africa be part of training packages if available?
Yes, for the training package, especially for sub-Saharan Africa, what I realized is in terms of health emergencies, capacity building is very, very important. So capacity building also comes in different stages. Stages of mass casualty incident management training, public health emergency management training, infection control, and safe and dignified burial. Because the reason why I'm saying such a thing is because Gambia has experienced COVID-19, and this COVID-19 has seriously affected our system, especially in terms of controlling the bodies that always have that are already COVID positive. So the people at the health facility, they find it difficult to manage those bodies, and at the end of the day, they will leave them to be at the mortuary for a number of days. But with the support of Kenyan Red Cross Society, we realized that if we leave things like that, it's going to be a little bit difficult for the country, and the management and the control of those cases will always be very difficult. So we collaborate with the Ministry of Health. So we communicate them and tell them, okay, why can't we do such a thing like organize a training for Red Cross volunteers? These volunteers are there, and they are willing to protect the citizens from getting infection every day. So they can be trained on safe and dignified burial. When I say safe and dignified burial, meaning you will bury bodies according to our norms. Like Gambia is almost 95% of Muslim, and the remaining 4% is Christianity, and 1% is other religions. So those Christianity and the Muslim, they have their own way of burying their bodies. So in terms of managing those bodies, it have to be their culture, how they bury their bodies. So therefore, we have to give a good name, which the people will be trusted, and give us the go ahead to bury those bodies. So this is why we gave that name as safe and dignified burial. So dignified there is following their norms, like to wash the dead body, to cover the body, to put the body in a coffin, or to cover the body in the white cloth, like how the Muslims do it, and take them to the graveyard and dig a grave, then pray as normal bodies, how they pray, then bury them. So we follow the dignified way. But the safe side also, we make sure they don't have direct contact with the bodies. We will disinfect the bodies and put on proper PPEs, that is personal protective equipment, then use those equipments and go with the body till we reach the graveyard and bury them. So that is the safe and dignified side of the burial. So mass casualty incident management training also is important, as I mentioned earlier. That mass incident management training really help us, because during this training, we coin it with infection control. Infection control, we do in disinfect environment, because we know COVID-19 and other emerging diseases that are epidemic prone, meaning they can cause an epidemic in any time or at any moment. So those epidemic prone infections, they are always present in the environment. So disinfecting the environment, putting on proper preventive measures will always help us to protect us and protect the population in terms of disease transmission from one person to another or from one environment. We train our volunteers in that mass incident management, whereby the sick people also will be segregated with the healthy people. Sick people will be left in isolation, then proper treatment will be given to them. And the people who are well, they will be protected and they will be prevented from having contact with people who are already sick. So we also do the training with the use of personal protective equipment like face mask, face shield, gloves, hard boots in terms of going outside the environment, especially within the environment that have been already contaminated. Public health emergency management. So we always talk about that one also during our trainings. So if we have a proper access to these training packages in sub-Saharan Africa here, you realize that most of this outbreak that normally occurs being Guinea-Bissau, Guinea-Conakry, then you come down to Senegal, and even in Nigeria, you know, it will really help us in a great deal. Notwithstanding, you can realize that in this past year, this 2021, Gambia has experienced a sort of outbreak of polio, but actually it's not like the people who are affected directly, but the polio virus was seen in some of the sewage used in the city of Banjul and the surrounding. So that result for Gambia to do mass vaccination for children under 5 to prevent them from contracting the polio virus. So actually, all these things together will really help us, you know, to maintain the status quo, to maintain the healthy environment for sub-Saharan Africa. If you can remember, there was one time an outbreak of Ebola in Guinea-Bissau, Guinea-Conakry. So in Guinea, there was outbreak of Ebola. Even during this COVID-19, there was a small episode of outbreak of Ebola in the same place. Also, there was outbreak of Marburg disease in the same Guinea-Conakry. So one can tell us that if we have a proper training for our people, especially the health workers and the Red Cross volunteers who are working in those environments, it will really help us to minimize the risk of getting infection. Because our volunteers, we don't only stop at disinfecting the environment or the use of proper PPEs. When we do normally go as far as infection control prevention measures, which include contact tracing and disease surveillance. In terms of contact tracing, we do community-based contact tracing and disease surveillance. So this community-based contact tracing and disease surveillance, how we do is like we will train our volunteers and tell them these are the signs and symptoms of Marburg disease, these are signs and symptoms of COVID-19, these are signs and symptoms of viral hemorrhagic fevers like Ebola. So those signs and symptoms, if you see it in anyone within the communities, send them to this particular health facility and they will be screened and they will be tested. If they are positive, then they will be isolated. So those volunteers who we are trained on that, they will also go out to the communities to sensitize them. And I prepare some slides. If you can see, if I can have chance to open the slide, you will see some of our volunteers how they do in terms of disease prevention and control in Gambia. So this training package really will help us if we have access to it.
Thank you very much for your contribution. Let's now move to the response during such a pandemic. Can I ask Naomi, again, from the Kenya Red Cross Society, as a renowned humanitarian organization and with great access to the last mile communities before, during, and after a health emergency, what major role has the organization played during the current COVID-19 pandemic to increase vaccines access to community members?
So Kenya Red Cross is a renowned humanitarian organization health emergencies, and it has a major role which it has members. So for us to increase this access, we've been again working very closely with the government of Kenya and the local government. We have two levels of government. We have the national government and the local government. Kenya Red Cross has great access to the local communities. So we leverage on the existing government structures to conduct community social mobilization. We are well endowed with the logistics. We have good vehicles. So we have been complementing the government efforts to ensure there's flow of vaccines to the last mile. Sometimes we may have the health workers available, but then they don't have means of transport. So Kenya Red Cross has been coming in handy to support the flow of vaccines to the last part of the community where we have inaccessibility. On the vice versa, again, sometimes we may have health workers, but we don't have the vaccines, and we also come in handy. And that's what we are exactly doing even right now, I'm speaking now. The community engagement Red Cross has been doing, we've participated in demystifying the myths. For example, our communities are still scared of these vaccines because nobody has disseminated them on what are the go to the facility. So what Kenya Red Cross has been doing, we did a survey to ensure behavior change takes place from informed decision. So where the folks are saying maybe if you get the vaccine, you'll get infertile, we show them that is wrong. We explain them, by the current government policies, we give the right information. Has also supported by offering a free tour line, which is accessible by communities to increase the feedback. The communities can be able to raise their questions and ask more about the vaccines. For example, if somebody wants to access the vaccine and they don't experience unusual signs, they can always call through that line and they are given the right feedback. Again, we are doing this in line with the government policy. We are using COVID-19 heroes. In our community, you'll find majorly women saying that I am still in the reproductive age, and I was told that if I get vaccinated, I'll never deliver. So we get women of their age who go through public address systems and they tell the communities, look, I was vaccinated and I'm still safe. The same for all the other age groups, the elderly and the youths. Are easily accessible like Facebook, WhatsApp group to ensure there's increase in access of the vaccine. We are using what do I mean here? We use the local media houses using the local. You will be at higher risk if you miss the vaccination and go to get vaccination. So we have been able to communicate to go and access because prevention is better than cure. We have been participating occasionally through stakeholders review meetings so that we can see where are we, which percentage of been left behind. So as a humanitarian organization, we've ensured that we are part and parcel of these monthly stakeholders review and planning meetings, which helps know the gaps and thus enhance strategizing better approaches to increase vaccines access and reduce the hesitancy to these vaccines. We are using every time we need to change the approaches given the terrain, also given considering the upcoming issues, we'll keep changing the approaches to fit the current demand or environment.
Thank you very much. Thank you very much. We can realize that there were a lot of concerns that you have tried to solve and try to find solutions. What about you, Emanuel, from Resolve to Save Lives? What were the concerns at the start of the COVID-19 pandemic in Nigeria, where you are based?
Well, I will speak a little bit. Thank you very much, Virginie, for the question. I'll speak a little bit about that and also maybe take a step back to really look at what the concerns were across Africa. So virtually all the countries in Africa had undertaken a joint external evaluation of international regulations and had a bit of a snapshot of how prepared they were, to respond to outbreaks. And when you talk about preparedness, virtually all the countries in Africa none of them were clearly shown to be prepared. If you talk about medical countermeasures and logistics, virtually no, the majority of countries, if you look at how GE scored, not prepared. So there were no systems in place, no medical countermeasures systems in place. And even though you found in many countries that systems had been developed for vertical programs, so vertical programs were in place for HIV, perhaps for TB, for malaria, but systems across board that could integrate, preparedness that was able to take consumables to the last mile outside these vertical programs did not exist. And therefore, from that point of view, that was a huge challenge. Another structural issue is the issue around the healthcare systems in Africa. We recall the panic that happened very early on in terms of access to oxygen when it became obvious that this was a need. The access to oxygen cylinders, concentrators, and the like, was a huge lack, and as well as the real concern around healthcare workers and people with the expertise to manage critically ill patients, as well as the fact that the issues of brain drain across Africa, where you have a lot of doctors moving across, from African countries to the Western countries. And the very low healthcare worker penetration across Africa. These were some of the real concerns that were there at the beginning of COVID. And these were, of course, juxtaposed against the experiences of African countries, especially those in West Africa, where they had been responding to quite a few outbreaks over time. We had, like in Nigeria particularly, Ebola, Lassa fever, yellow fever, meningitis, all in the last 10 years. And therefore, even though we know that a lot of Africa, the countries across Africa have experience in responding to outbreaks. The systems are not resourced enough to deal with a pandemic of this nature. Clearly, we've kind of seen that emergence of organizations have helped coordinate, like the Africa CDC, which we talked about earlier, as well as the Afro region of WHO, as well as organizations like the World Food Programme. New partners have Global Fund and so on have come onto the space of global health security and helping us understand that beyond the health system, all these other pieces are really essential for effective preparedness and response. So, in short, in Nigeria, these were the basic issues. But the development of a National Public Health Institute as a coordinating mechanism has been very useful to help coordinate the issues, the provision of logistics and supply chain systems for lab supplies, which became very important, for PPEs, which also became very important to ensure that medical systems were continued, as well as now supporting vaccine distribution, last mile distribution, just like Kai Dede talked about. I mean, there's still a lot to be done, clearly. But I think that's why that's why we're having this conversation. Thank you.
Thank you very much. Thank you very much for all the for the contribution. Let me now turn to Ibrahima Jabi from the Gambia Red Cross Society. I have a question about the vaccine supply chain management. How can national societies be part of it? And my second question to you would be, during emergencies, to have access to market in terms of medication and vaccines, are there any mechanisms of emergency supply, and how can Gambia have access to these emergency supply? Over to you.
Thank you so much for that question. Also, like what I'm saying earlier was about the training package. But this time around, what I want to buttress on is access to vaccines and vaccine supply. The reason why I come up with the vaccine supply and the vaccine chain management is Gambia Red Cross Society normally works with the Ministry of Health directly. But in terms of vaccine storage, vaccine supply is always difficult. We don't work with them directly because we don't have the capacity and we don't have the materials that can help in to transport those vaccines from outside to the Gambia, or we don't have access to how to purchase those vaccines and bring them to the Gambia. Because during COVID-19, if you can see, there was this vaccination process taking place. I personally took part in the vaccination process because I'm a trained public health officer, and I've been doing vaccination for a series of years, that is from 2010 down to 2016, before I will leave Ministry of Health for Red Cross. I was doing the vaccination and vaccine cold chain management. I was doing that one also. Since I come to the Red Cross, I realized that the Red Cross is doing very well for the country. But in terms of vaccination, they only stop at social mobilization. We go out to talk to the population and tell them this social vaccine is very good. We can use it, it is safe and it's good for us. But we don't directly participate in injecting or administering vaccines to the population. So if we have access to training packages, which we can even help us to work with Ministry of Health, and we train our volunteers on cold chain management. So therefore, we can also have vaccines in our various branches, whereby Ministry of Health gets shot, then we can support and get them. During COVID-19, this thing affects us very well because Gambia solely rely on donors in terms of giving vaccines to under 5 population, that is routine vaccination. But that routine vaccination was ongoing. Now COVID-19 appears. So COVID-19 vaccine also was in the market. And Gambia, whilst Gambia was only relying on donors to give us vaccine and vaccinate our people, most of the under 5 population. Now the adult have entered in the system. The old age have entered in the system through COVID-19. Now COVID-19 vaccine, was without the support of UNICEF to chip in, Gambia will not have COVID-19 vaccine. But this is why I'm saying, okay, how about if Gambia Red Cross Society enter into this activity of trying to organize a system whereby there will be emergency vaccine supply when the need arises. So if issues of COVID-19, issues of other emergency diseases, that could be a pandemic or that could be endemic, or can even cause outbreak. So those vaccine, emergency vaccine supply storage can be used to vaccinate the population that need it. Because now, when the government is solely relying on routine vaccination for under 5 population, and the adult population are there in need of COVID-19 vaccine or any other vaccine, that it could be Ebola vaccine, it could be Marburg disease, it could be Rift Valley fever vaccine, and so on, with the adult contact. Now the population is been solely relying on donors, and that donors are supporting only under 5 population. So these other population will be left like that without any support, and that could be so dangerous to the country. This is why I said, okay, let me come up with this question of, can Gambia be, or even Sub-Saharan Africa, can be part of an initiative sort of, which is emergency vaccine supply system. So if you have that emergency vaccine supply system, it doesn't actually mean we will have vaccines stored here right now. No, we will have a link with institutions that produce vaccines. That is the Serum Institutes of vaccines. They produce vaccine at all time. So we will have a link with those industries in the Western or in India or in the US, sort of. So we can have that link with them in case there is an outbreak of disease and they produce vaccines. So Gambia can be prioritized and give us that supply if we have it. Then the supply will really help us in terms of emergencies. It can help us to get rid of that particular disease that is affecting the population. Okay. So during emergency also, that is the second part of the question, that is to have access to the market in terms of medication and vaccine. It has some link with the vaccine supply chain management, but this time around, I will focus more on medicine supply. Okay, when I say medicine supply, meaning during emergencies, disasters, all shops will be normally closed. All places that sell medicines, pharmacies, and so on are normally closed. But if Gambia have access to the outside world, whereby they can have this emergency drug supply, so therefore, if there is an emergency and all the pharmacies are closed for the country, there will be no drug supply. Many people will get sick. So if Gambia Red Cross Society have access to emergency drug supply, then therefore medicines can easily enter through Gambia Red Cross Society and supply people who are dearly in need of those medicines. There are certain medicines which are emergency medicines, especially medicines for diabetic patients, medicine for hypertensive patients, medicines for pregnant women, medicines for children under 5. So those medicines are very, very important. If they get lack in a country, that country normally runs into problem. The health system of the Gambia is very weak. So if disaster strike, normally the weak system that is there always crumble. This is why for COVID-19 we really suffered in the Gambia here. There was almost 1 year without a drug supply, without a proper vaccine supply. So that really affects us. This is why I was saying, like, if Gambia can have access to in terms of medication, can have emergency drug supply system, emergency vaccine supply system, then the system will really help us to combat certain problems in terms of medication. So these are a few questions that I have to answer, unless you have any other questions, and move ahead and see how can we answer them. Thank you so much.
Thank you very much for your contribution. Now let's look at the lessons learned. Of course, we are not done with the pandemic, and there will be other disease outbreaks and pandemic, but we can already draw some lessons learned from all this experience that you have shared with us. Can I give the floor to Resolve to Save Lives and Emanuel? You co-wrote a paper about Africa's response to COVID in BMC on Africa's response last year. What were the highlights of the articles, and what else has happened since then?
Thanks. So we wrote this paper early last year, just about a year ago, really looking at the responses at time that there was like a few months in. Africa at that point, we were just recording, we're just recording the first wave, just the first 20,000 or so cases. Since then, we know that things have progressed. One of the challenges that we saw at the time was that the benefits of the systems that had been in place previously, for instance, the fact that there was the IDSR system, which is the Integrated Disease Surveillance and Response System, and was in place across many countries. And so this kind of gave the basis for surveillance systems. So it helped with contact tracing of patients, helped with ensuring that systems were in place for identifying cases when they popped up, and so on. Another thing was really looking at the potential impact of public health, social measures. And I know we're talking about, we talked earlier about the impact of lockdowns and how that affected communities. And I think the World Food Programme was very instrumental in providing support to many countries because of the impact of the lockdowns in many communities. The Resolve to Save Lives did it was part of the collaboration, the PEC collaboration, the Partnership for Evidence-Based Response to COVID-19, and has done 3 series of surveys across Africa, across 21 countries, and have shown a trend right from the start of huge levels of vulnerability, where many people in many communities were obviously didn't have the resources to stay at home for more than 7 days or so, and therefore, the supply chain systems that were now set up through organizations like World Food Programme and some countries also trying to provide those resources definitely helped with alleviating the impact. And we did see that there was some social upheaval in some countries, including Nigeria, when some of those resources didn't get to the right people. Challenges with accessing PPEs was a huge problem, and I think it had a huge impact on maintenance of essential services, and a lot of people were unable to access care for various types of treatments, including hypertension, which we're interested in, HIV, and so on. And so people's keeping care because of access to healthcare services was important. And it's a knock-on effect where healthcare workers did not feel comfortable enough to go into the health facilities, and particularly because they couldn't access these last mile supplies for PPEs and so on. We did talk a lot about the use of innovative technology and how across Africa people were beginning to adopt new technologies in distributing materials. So we saw experiences in Rwanda, for instance, where drones were being used to distribute test kits, lab supplies, in the same thing in Ghana, and across the world. You began to see that these new technologies were now being used. Mobile phones became very important for contact tracing. Mobile phones also became increasingly more important for tracking supplies, as well as communication, as well as provision of clinical services. So this innovation, as well as local manufacturing. I mean, the other critical thing has been a boom on local manufacturing of basic PPEs like face masks and use of innovative material instead of your like cloth and so on to make face masks in country. And then a lot of countries started manufacturing sanitizers as well. So this is a critical thing that really came to the fore. And I think that as experts in this area, a lot should be done to sustain local manufacturing, and supply chains should tap into those local resources so that whatever investments have been made become sustainable in the long term. And then finally, I think what we talked a lot about communication, the importance of communication. And I think more than ever before, the need to hear for countries to hear from partners, investments that are being made, and timelines for pipelines for various kind of supplies is critical. The work that was done by Jabi to set up various pipelines for vaccines across the world is also very critical now. And of course, the need, I wouldn't call, the various partners globally who provided vaccines to the Africa CDC and for distribution to various countries. These innovations and this support were also critical and were things that were highlighted and have continued to support the response in Africa. Over.
Thank you very much for your contribution. May I ask Hitesh to take the floor for additional comments? Over to you.
Thanks, Virginia, and Emanuel. Very, very great insights into what's going on at this point in time. I wanted to just say a few words about the global response as it relates to what's going on in the countries as well. I mean, I think we don't have to look that far away from the independent panel for pandemic preparedness and response report that was published in May of 2021. And I think the two points that I want to raise there is really around the financing. In that report, it was President Johnson Sirleaf and Helen Clark who raised the issue that the G7 needs to commit to providing 60% of the 19 billion that's required for the ACT Accelerator, and this for 2021, right? For vaccines, diagnostics, therapeutics, strengthening the healthcare system, and the rest will come from the G20. And then the other point is that, Africa faces a dire shortage of COVID-19 tests and therapeutics. And it was mentioned earlier on about, the lack of oxygen. And I think most importantly is that we don't have a very good sense as to what's going on in the continent because of a lack of testing. And so another recommendation that came up was about the provision of financing for testing and for the Global Fund to be able to provide that kind of funding. And then you would have seen in October, there was this G20 announcement that was made around, again, putting together like a new pandemic task force, but then no financing attached to it. And then I think it was on October 26th, the Global Preparedness Monitoring Board concluded that the world is woefully unprepared for the current pandemic and also for anything that's going to happen in the future. So I guess there's a systematic pattern that has started not just now, but from the time the SARS epidemic broke out in 2003, with all the different plans and regulations coming on board, the strengthening of the IHR. I think we can be sure that there's going to be new zoonotic outbreaks in the future. And I think the response that the world has provided for this pandemic is not a good predictor as to what's going to happen in the future. It's great that we all are getting together around these things and I think understand what has to be done. But at the end of the day, if the financing to be able to set up these kinds of systems is not there, we are not going to get ahead of these kinds of things. And if we do not get around the nationalism, the country bureaucracy, the multinational dynamics and the politics, we will not win with the COVID-19 pandemic. And I think this will be a poor signal going into the future. So that's what I wanted to say about what's going on with the global response and how it relates to the country response. Insofar as what's happening in Africa, a few words just to mention there about the Africa CDC, and I'm going to stress on this. It was a proud moment in time to see the investments coming into the African continent alongside the Africa CDC around vaccine acquisition. And then you saw the announcement over the summer of this year with the MasterCard Foundation committing to about $1.3 billion worth of financing for the Africa response. It's not enough. It's absolutely not enough, but it's a good sign that, there are partners out there that are willing to put money behind this. And I think what was great about this is that, they saw recognition that the Africa CDC was a key and pivotal instrument of the Africa continent to lead its global health security. And so, what that means is that, acquisition of vaccines, distribution of vaccines, setting up laboratory networks, etc. So it's a good platform for the continent to go forward. However, if the financing is not there going into the future, I'm afraid that we're going to be facing this discussion over and over again. So again, this is not something that we can solve here on this call, but it's something that we need to be taking very seriously and we need to be advocating for at the highest levels possible. Thank you, Virginie.
Yes, indeed, it's a very good point. Funding is something that we need to look at the highest level, and this group of donors should be aware of all these challenges we are having to make sure that they can fund the different activities. Thank you very much. Can I turn again to Naomi? We have mentioned strategies and different activities that are in place. What are your comments on these strategies that have been put in place to enhance community preparedness for epidemics and pandemics?
we need to have strategies in place to enhance community preparedness for epidemics and pandemics. And Kenya Red Cross has put very for epidemics and pandemics. We all know that epidemics start and end with communities. Community-based actions are surely critical in managing communities to understand their vulnerabilities and capacities so that they can be able to be at the center of the crisis when it occurs. We the local solutions. We are ensuring that there's active and well-organized communities units, which we call through a strategy we call community health strategy. This is where villages have one focal point of entry and information. Focal points in the community or in the villages that we are calling community health units. We know that a well-prepared community needs a greater health workforce. So being a developing nation occasionally challenged by a lack of enough healthcare workforce. So the national society, that is Kenya Red Cross, is also working closely with the healthcare workers on the aspect of emergency preparedness for safer and more resilient community. Community-oriented, and we already addressed as need be. We've put effort in preventing potential diseases that come from animals, but we also have other diseases that can emanate from unsafe water. We have vectors, we call them vector-borne diseases. So what we are doing, we've put in place measures or approaches that we call in pandemic perspective, is whereby we have ensured that this community or the vibrant community-based surveillance, which is key in enhancing community preparedness. We have trained or sensitized communities on how to report using technology. We have community readers or volunteers who have been trained to use the technology using the phones. The phones are installed with the free toll lines, which is taken care partially by the organization and supported by the government policy. So a volunteer or a community member, these volunteers come from the villages where they live, so they can freely pick on diseases and know that there's something new which is coming in our community and has not been there. So they can always report to the nearest healthcare worker, and Kenya Red Cross comes in handy during response also to support. We play an auxiliary role to the government of Kenya, and we are ensuring that the primary health care through universal health coverage is well disseminated to the communities to enhance or increase access during or after epidemics. The organization has been able to leverage on these existing Ministry of Health structures. As I said earlier, we call them community health strategies. This enhances hospital referrals, and all the community members have been disseminated using various non-costs, both formal and informal platforms. We call them community dialogues, whereby the community members can congregate and discuss the existing problems, and during the discussions, they can also come up with local or tailor-made local solutions. We are also strengthening the health structure by capacity building the health officers on quarterly basis or as need be. Without waiting for the routine quarterly dissemination, we respond in emergency or during a crisis with the emergency response skills. We are using the lowest community level structures, whereby we have congregation of people through chiefs barasas, and we are also using the local medias and other local governance structures we call community health committees to ensure that there is policing. Let me use the word policing. Policing means that the local community structures governance can be able to enhance roles without necessarily waiting for the legal structure put by the government. These village elders have been capacity built, and they can always ensure that diseases are reported in good time before the health workers are on ground or come on ground. The other aspect is ensuring that the community has resources in place. We cannot just be sitting there and waiting for epidemics as a community, and we become the recipients always. We have ensured that the community has resources in place such that when an epidemic occurs and the government maybe has taken time to respond, we don't have to wait for the support from the government. We have to resource mobilize and even hire vehicles and send patients to the hospital without necessarily waiting for the universal health coverage through ambulance or any other NGO support. So we have ensured that the community has enhanced socioeconomic strategies that is working for them. And for us to end epidemics in the world, even in our country, we have to ensure the community has the right information and we have sustainable behavior change structures they can always refer from. Thank you.
Thank you very much for the contribution. As one of the panelists has mentioned earlier, we cannot, the response to these emergencies and disease outbreaks cannot be solved alone. It has to be a collaborative approach. And I think that the private sector can support these efforts. Can I ask Dr. Kai Dede Submu to tell us what are the options for countries to leverage expertise in the private sector to support efforts on pandemic preparedness? How can countries leverage such private sector expertise in pandemic preparedness? Over to you. Thank you.
Thank you very much, Virginie. Again, a pleasure to be back. Interesting conversation so far, looking at all sides of the discussion from prevent to respond. But this is a very important point that I think we all need to address collectively, because there's no point having resources that we can tap into in times of need, especially in emergencies like this. And repeatedly over time, but more particularly in Africa, I mean, if we start from the spectrum of healthcare service delivery, the private sector delivers close to 60 to 70% of services to the population. While it's not ideal because they pay out of pocket, but it can be negligible. It's not negligible. You can't neglect that immense amount of service provided. But beyond service delivery, let's look at how the private sector contributes to health system, for example. So in terms of vaccine logistics, in terms of vaccine manufacturing, last mile delivery, innovative financing mechanisms. You know, there's so many opportunities for the private sector, for lessons, and for a lot of existing capacity to be leveraged from the private sector. And I'll mention a couple of examples. You know, right now, given the pandemic that we are in, and within the Africa CDC's agenda for local manufacturing of vaccines, there's those capacities that exist within the continent that I think countries should be able to leverage. And I understand that the Africa CDC is building a lot of framework around that to ensure that this is immensely tapped, and in the immediate to short term, the country is better positioned to be able to harvest these resources to at least be able to refill vaccine vials. Of course, we know the implication of that to the supply pipeline of vaccines on the continent. I mean, having these resources closer to where they need is very essential, and these institutions and facilities would definitely be of a huge advantage. In doing that, I mean, there needs to be opportunities to build human resources. You know, so across these centers, there are various learning exchanges and opportunities for existing human resources within the continent to quickly learn and get into the science of vaccine manufacturing and production. Of course, the return of that to African economies is that I think the younger population have opportunities to channel their energies, and this has untoward effect on affecting the economy. Again, there are various long-term implications of that, good implications of that to the various countries. So there are those opportunities, but also within the private sector, given various licenses and various scientific advancement in research and development, they can also quickly capacitate the public sector, such that these resources, yes, it's a bit controversial, but in the circumstances we're in and in the spirit of equity, these are essential points that need to be considered across both sectors. Private sectors work in the space government, in the enabling environment governments provide. So these needs to continue. And of course, on the government side, on the public side, all this need to continue to be made available so that the private sector can particularly thrive. I will touch upon 4 key areas that I think the Africa CDC is very big on. And I think over time, through support with UNICEF as well, there's a lot of efforts to support African countries and also countries within the Gavi portfolio to leverage resources within the organization, but also reaching out to third-party logisticians to support vaccine rollout across various buckets. But specifically, I know the Africa CDC is big on capacity building, again, growing in-country capacity. The private sector, as I mentioned earlier, can be a very huge resource or opportunity or good institution to quickly upskill the available human resource that are currently available, but also additional ones that will be supporting efforts in the pipeline. Very critical is supply chain. We can't overstress the importance of supply chain across the various levels, from the manufacturer up until the last mile where vaccines are being delivered. So there are a lot of touch points. I mean, we'll give an example of fast-moving consumer goods who have very strong and resilient supply chains. Colleagues from the WFP have also been able to support that over time in various circumstances. But we understand that for the response, there needs to be opportunities to keep strengthening those. I mentioned earlier that some of these efforts are leveraging existing routine immunization systems, for example. So while I believe we are pushing to get the whole world rapidly vaccinated, we should also pay attention to some of those existing systems that still need additional strengthening. Again, so some of the efforts we're putting in right now do not further verticalize the system. They are well thought of and they are integrated within existing systems. We should be better health systems. Those existing supply chain systems and tools need to keep being strengthened with the people so that we do not verticalize the system further. We need to integrate this within existing systems so we have a more resilient system to respond to outbreaks. And there's a lot of lessons the private sector can learn, the public can learn from the private sector and vice versa. In Nigeria, for example, there were a lot of innovative financing mechanisms that were quickly deployed to support the COVID response, but also in other areas such as transportation, whether be it air freight or through local transport, to make sure that commodities were moved and pre-positioned across settings. Partnerships, and I think I highlighted this earlier, and this has got to happen at the global level, but also at the local level. Again, at national, there's a different conversation, but also at sub-national levels, and even beyond that. Those partnerships have to be very, very interconnected and ingrained, such that you don't also neglect the communities. I think the colleague from Red Cross mentioned the importance of the community in this. My very good old friend and colleague, Dr. Emanuel, mentioned the need for national public health institutes. Very, very essential. We often talk about leadership as being important. If you're looking at the health system blocks, absolutely. And within the Africa CDC, there's a lot of push to ensure that the national public health institutes are well capacitated to be able to deliver, to prevent, detect, and rapidly respond to outbreaks. But in terms of a few other enablers, I would say information sharing is very important. And this cuts across. So from the community where things are detected early up onto different levels of response, for example, laboratory data sharing. You can agree with me, there's no surveillance, for example, pandemic preparedness or any preparedness you can do without sufficient laboratory data. And given that the private sector, for example, provides a whole lot of services in a couple of African countries, there's a need for that intentional investment. Of course, led by National Public Health Institute, but the frameworks are available to make sure that this data is shared across all platforms. Again, this enables intelligent decision-making that can provide, protect everyone. There are also essential work around medical countermeasures and stockpiling, and also standardization of commodities. If you think about the outlet of these commodities, be it through local pharmacies or through local vendors, I mean, that standardization has to be done across board, such that where the client is receiving services, you are guaranteed that quality services are being delivered. So in a nutshell, on both sides, I know there have been opportunities for creation of hubs, innovation hubs to drive supply chain demand or supply chain innovations. Absolutely, that should continue. Existing government-led and donor-led, as much as possible, alliances need to continue. I mean, talking about UNICEF and within the IIC2 Global Alliance partners, there's a whole lot of support that has gone into rapidly upskilling and ensuring countries have sufficient capacity for ultra coaching equipment. And that's understanding the balance between the manufacturers of this coaching equipment and finding the avenue to rapidly transport and pre-position them at the various points of need. Again, that needs to continue. Again, also framing this within the existing global agenda, such as COVAX and also the AVAT that Africa CDC is leading on. And where necessary, again, like I mentioned earlier, I like this in terms of calm. Those agreements that will enable, or MOUs that will enable smooth running between public and private sectors should be schemed out, rehashed, through various exercises, simulation exercise, or reviewed, so that when there's a need for those responses, everyone knows the button they need to press and what they need to do specifically to mount a robust response. Over. Thank you very much, Virginie.
Thank you very much to you. We don't have a lot of time left, but I can see that Itesh would like to take the floor. So please, over to you before we close.
Thanks, Virginie. Thanks, Virginie. Yeah, I just wanted to make a comment on the private sector. I think if we just go to the WHO Afro website, we'd see there that of the 2 billion that's needed for operational financing for this current pandemic for Africa, only 1.2 billion is still needed. So I asked the question then, how are we even going to think about private sector if the financing is not there? When the financing is there, what is the likelihood that we can tap into the market of private sector logistics providers? And I'm looking purely at supply chain in an expedient way to ensure that vaccines reach the intended beneficiary. It is important for us to think about that. And also in the context of the African continent, where you have different maturity settings that demand different ways of delivery. In some markets, strong private sector, but the financing must come into play. In other settings, there is no private sector. So what do we do then? How do we respond to a pandemic when the market is not mature enough to be able to sustain that? And so, yes, absolutely support the concept of and the call to action around private sector, particularly in times of pandemic and also in times of normal health routine delivery. It's important to understand that, under the current context of immunization programs, health programs, that, it's the efficiency of what we do is not great. So if we're looking at a pandemic, we need to step that up at least tenfold. So yes, my point is financing, tap into the private sector where there's a market, also be innovative in markets where private sector is weak. Thank you, Virginie.
Thank you very much for the points you just raised. These are very interesting. I would like to thank very much all the panelists for all these contributions. I would like to thank those who joined the session today. And if you have any questions, please use the chat and we will be happy to answer. Thank you very much to all.